ACE inhibitors. Things to keep in mind when using them. ACE inhibitors are a group of drugs widely used in the treatment of high blood pressure, heart failure, and kidney disease. They work by inhibiting angiotensin-converting enzyme ACE, which plays a crucial role in regulating blood pressure. Potassium levels. Use with caution and monitor serum potassium regularly. ACE inhibitors can raise potassium levels in the blood. Therefore, they should be used with caution and serum potassium should be monitored regularly. Potassium levels. Avoid potassium supplements or foods high in potassium to reduce the risk of hyperkalemia. Avoid potassium supplements or foods rich in potassium while taking ACE inhibitors. Diabetic patients. Monitor blood sugar closely in the first month of treatment. Diabetic patients taking oral medications or insulin should have their blood sugar closely monitored in the first month of treatment with ACE inhibitors. Drug interactions. Avoid combining with the following drugs. Lithium. Combining lithium with ACE inhibitors can increase the risk of lithium toxicity. Potassium-sparing diuretics. Combining ACE inhibitors with potassium-sparing diuretics can increase the risk of hyperkalemia. Drug interactions. Dual renin-angiotensin-aldosterone system RAAS blockers. Combining these drugs can lead to severe hypotension, hyperkalemia, and impaired kidney function. Lithium. Combining lithium with ACE inhibitors can increase the risk of lithium toxicity. Drug interactions. Potassium-sparing diuretics. Combining ACE inhibitors with potassium-sparing diuretics can increase the risk of hyperkalemia. Dual renin-angiotensin-aldosterone system RAAS blockers. Combining these drugs can lead to severe hypotension, hyperkalemia, and impaired kidney function. Drug interactions. Avoid simultaneous use of ACE inhibitors and angiotensin-2 receptor blockers in patients with diabetic nephropathy. This can increase the risk of kidney failure. Lithium. Combining lithium with ACE inhibitors can increase the risk of lithium toxicity. Drug interactions. Potassium-sparing diuretics. Combining ACE inhibitors with potassium-sparing diuretics can increase the risk of hyperkalemia. Dual renin-angiotensin-aldosterone system RAAS blockers. Combining these drugs can lead to severe hypotension, hyperkalemia, and impaired kidney function. Pregnancy. ACE inhibitors should not be used during pregnancy. ACE inhibitors can harm the fetus. Change treatment method if planning pregnancy. If planning a pregnancy, patients should switch to other antihypertensive medications that are safe for pregnant women. Additional information. ACE inhibitors can cause side effects such as dry cough, dizziness, fatigue, nausea, diarrhea, and headache. Inform your doctor if you experience any side effects while taking the medication. Do not stop taking the medication without your doctor's advice. Additional information. The information provided in this article is for informational purposes only. It is essential to consult with a healthcare professional for personalized advice and safe and effective use of the medication. Further additions. Mechanism of action. ACE inhibitors work by inhibiting the conversion of angiotensin I to angiotensin II, a potent vasoconstrictor, leading to vasodilation and lowering blood pressure. Specific examples of ACE inhibitors. Some common ACE inhibitors include lisinopril, enalapril, ramipril, etc. Further additions. Long-term benefits. ACE inhibitors can reduce the risk of stroke, heart attack, and kidney failure, particularly in patients with high blood pressure or heart failure. Further additions. Lifestyle modifications. Lifestyle modifications, such as diet, exercise, and stress management, are important for effective blood pressure control in conjunction with medication. Further additions. These additional points would make the article more comprehensive and informative for readers seeking information about ACE inhibitors.